Doctors say the state's new position to not recommend COVID-19 vaccines for healthy kids is very frustrating. They've already been attempting to overcome vaccine hesitancy, especially with younger age groups.
Overwhelming current scientific evidence clearly supports that all eligible individuals, not just children, but all eligible individuals, including children, should be immunized. Millions of doses of this vaccine has already been given, so I don't think the safety is an issue. We know it's safe.
As of Friday, 22% of children ages 5 to 11 in our state have been vaccinated since those became available in November.
We wanted to know what data the state is basing this new position on to advise against healthy kids getting vaccinated for COVID. In this guidance, they cite a recent study by the New York State Health Department, also reports on myocarditis in older teens. So we took these to some of our local pediatricians and epidemiologists for some sharper insight.
The data that's coming in on this is showing for healthy kids very little benefit.
Governor DeSantis and the state's new Surgeon General are basing this new guidance off several recent studies, including this one from New York. It found vaccine effectiveness in young kids dropped significantly during Omicron to just 12% protection from infection. But UF pediatrician and epidemiologist Dr. Sonja Rasmussen says that same study also found the vaccines were still largely effective against the most serious illness.
And we know that Omicron was a variant that the vaccine wasn't as protective. So I think it makes sense that they can see some waning. Certainly didn't say it didn't work.
Florida's health department is also citing concerns over myocarditis in teens. But Dr. David Berger, he's a Tampa pediatrician who often works with skeptical parents since he accepts families at his office who don't follow the traditional vaccination schedule, says myocarditis after vaccine, while possible, continues to be an extremely rare occurrence.
Yes, myocarditis can happen following the vaccine, especially in adolescent males. But we also know that COVID can cause myocarditis, which is more severe than the myocarditis that one would get from the vaccine.
And both doctors agree.
The data have really shown that parents trust their child's doctor.
I call out people on both sides of this conversation of being too absolutist and not recognizing that this is a subtle but important decision that each family has to make.
Worth noting, the New York study also has not yet been peer-reviewed. There's actually a note at the top of the study that says it should not be used to guide clinical practice.